Thousands of recently retired clinicians could soon be called on to help cope with a surge of COVID cases. The state government expects demand for intensive care to peak next month. The hospital system is already under strain. Investigations are underway into a major coronavirus outbreak at Liverpool Hospital. Rani Heyman is live for us in Sydney's West. Rani, it's not the first outbreak at Liverpool Hospital that they've had to deal with there.
Jeremy, this is the second major outbreak here at Liverpool Hospital, but what makes this different is there have been exposures across at least 4 different wards. 28 staff are in isolation and genomic sequencing is underway to work out whether these cases are linked. If not, this could pose real trouble for not only this hospital but the system, which is already under pressure. To help, the government is enlisting retired healthcare workers to bolster the workforce. Northern Beach's GP, Dr. Margaret Howsam, had retired, but when COVID hit, she wanted to help.
I felt that we could not put up your hand, given the fact that we weren't currently working in the field at the moment.
Dr. Howsam is one of 29,000 healthcare workers nationwide now eligible to return to the front line in anticipation for an overwhelmed hospital system when the state reopens next month.
Over 6,000 nurses, over 400 doctors, over 200 psychologists and over 180 pharmacists who'll be on the sub-register.
The state hospital system here and in Victoria are both under pressure, as you'd expect, because we're in the middle of a pandemic. But the planning has been done.
New South Wales Health formally requested help from other states earlier this month. Only 2 staff from Western Australia responded and none from Queensland. The state has recorded 1,063 new cases. 6 more people with COVID have died. A second outbreak at Liverpool Hospital in Sydney's West has authorities concerned. 20 patients and 5 staff have so far tested positive following exposure events in 4 separate wards.
Those investigations are underway to see what might be links between those patients, if at all, noting that we also have a high number of cases in the community.
All staff who have tested positive in this latest outbreak are fully vaccinated, and 97% of all staff inside the hospital have received at least 1 dose. Across the state, 55.5% of over 16s have received both doses of a COVID-19 vaccine. The numbers of vaccinated children aged 12 to 15 years is also rising quickly. 110,000 have now received their first dose. That's 28%. Despite increased vaccination rates, cases are still rising in regional New South Wales. New cases have been recorded in Tweed, Coffs Harbour, Cowra and Hilltops, which remain in lockdown. Numbers have also risen in Broken Hill and in the state's south. There have been 65 new cases in the Illawarra, there were 41 in the Hunter and 32 on the Central Coast. Glen Innes and Orange will come out of lockdown from midnight.
Can't wait to have customers in again, so good, especially on the weekend.
It's exciting, it's exhausting, it's a bit uneasy, but I think it's going to be really great.
A sweet taste of freedom. Rani Heyman, ABC News, Sydney.
It's been revealed an audit is underway of every classroom in New South Wales to make sure they're COVID safe. Let's bring in Kathleen Calderwood. Kathleen, what more can you tell us about this audit?
Jeremy, the Education Department is now halfway through an audit of more than 150,000 classrooms and shared spaces to determine if they're adequately ventilated. A State Parliament inquiry was today assured by departmental officials that no cost would be spared to make classrooms safe. Victoria has spent $125 million on 51,000 air purifiers to go into nearly every school there, but the inquiry heard that to date, no such purchase has been made in New South Wales.
I'm asking you the number. If the number's 100, tell us it's 100. If it's 51,000, tell us it's 51,000. But if it's naught, please tell us it's naught. What's the answer?
I confirm we have as yet not ordered any purification systems. We are pending the results of the audit, defining the specification of the systems we will need. And should we need any, we will then get into the procurement process.
Jeremy, we can also reveal that just a week out from the deadline for all New South Wales health staff to have had at least their first dose of a COVID-19 vaccination, 91% of workers have now met that requirement and 85% of all public health staff are now fully vaccinated.
Kathleen Calderwood reporting. New South Wales has now recorded more than 50,000 coronavirus cases since this wave began. But the curve is improving. Here's our data analyst, Casey Briggs.
Well, this gradual improvement that we're seeing day on day is just continuing its pace. The 7-day average in New South Wales at the moment is about 1,100 cases, and we're seeing real sustained improvement at the moment in the LGAs of concern, both in the ones that have had the most cases, Canterbury, Bankstown and Cumberland, but really across all of Western and southwestern Sydney, we are seeing these cases subside. Take a look too at the Sydney LGAs that aren't in those LGAs of concern, in particular the City of Sydney and the City of Randwick, where we've been watching very rapid growth in case numbers. That has been halted and it's even starting to subside at the moment, so hopefully that continues. But we do still have some fires burning, particularly in regional New South Wales, where the numbers are lower than what we're seeing in Sydney, but the trend line is going in the wrong direction. And that's partly significantly being driven by cases in the Illawarra Shoalhaven region. Cases are thankfully subsiding in Western New South Wales, but we are also seeing more than 20 cases a day in the Hunter New England and the Central Coast local health districts of New South Wales. And New South Wales is hurtling towards that 70% double dose mark when the rules will start to lift. And as a state, New South Wales will probably hit that mark in the first week of October, making the rule easing day likely Monday, October 11. But these regional areas, they have on average lower vaccination coverage than the capital. Could that pose any problems?